Testing is so critically important to help reduce the spread of COVID-19. If you have symptoms or have had known exposure to somebody with suspected or confirmed COVID-19, you really should be tested, regardless of your vaccination status. So self-testing is it's very quick and it's a convenient way to test for COVID-19. These tests are sometimes called home tests, they're sometimes called at-home tests, and you'll even hear them referred to as over-the-counter tests. Self-tests are really best used if you've had COVID-19 symptoms or if you've been exposed or even potentially exposed to an individual with COVID-19. What do those symptoms include? Fever, chills, cough, shortness of breath, fatigue, muscle or body aches, headache, a new loss of taste or smell, sore throat, congestion or a runny nose, nausea or vomiting, and even diarrhea. So the question is, how do you go about getting a test? And how do you actually administer the test? So the tests now are available at drugstores throughout the area. There's many manufacturers that you can choose. These are just two. All the tests are essentially the same. When you get your kit, you should open it up, take out all the materials that you'll need. First, the instructions, the swab, the test card, and the reagent that it sits in. Be sure you wash your hands, use a hand sanitizer, and scrub down the area that you plan on doing the test. Here's your swab. You need to insert it at least a half an inch, no more than about 3/4 of an inch in each nostril. You're to circle it around at least 5 times for a total of 15 seconds. Now I'm going to do the other nostril. Next, you put it in the solution, your swab. Move it around per the instructions that you have from your particular manufacturer. Then you remove the swab, put it back in its sterile container, put the cap back on, then take your card and you put 3 drops in. Then you have to wait at least 15 minutes to see the results of the test. If your test results are positive, it's really important to follow self-isolation rules. Inform everyone that you've been in contact with the previous 48 hours. Report your test results to your local health department, your state health department, or your personal physician. Obviously, if your illness becomes severe, you should seek immediate medical attention. Now, a negative test. A negative test is a good indicator that you're not infected, but it doesn't totally rule it out. Repeating the test will really increase the confidence that you truly are not infected. We're continuing to explore all sorts of new options to ensure that our members have access to tests when they need them. For Blue Cross Blue Shield of Michigan members, more information on testing and coverage can be found at bcbsm.com/coronavirus.